Welcome to today's deep dive. Right now, as we speak, people are paying hundreds of pounds to have purified salmon sperm injected into their
Yeah,
faces.
faces, their scalps, and even intimate areas.
Right. I mean, it sounds completely like bizarre science fiction, but based on the sources we're looking at today, it is rapidly becoming like the most sought after regenerative treatment in the aesthetic world.
It really is a massive leap forward. I mean, we are moving entirely away from that old model of just, filling in wrinkles with inert gels.
Right, the traditional stuff.
Exactly. And we're stepping into the realm of true localized tissue engineering.
And that is absolutely the mission of our deep dive today. We are going to explore exactly what happens during a polynucleotide treatment. Like, what is the physical reality of sitting in that chair for you, the patient?
That's the day-to-day experience.
Exactly. But more importantly, we are going to look under the biological hood. Why are we using fish DNA? How does it actually force your skin to thicken by over 50%?
Well, to get there, we really need to establish what polynucleotides actually are in this medical context.
Okay, lay it on us.
So we are talking about highly purified, long-chain, polymerized DNA fractions.
Right.
And they're extracted from extremely compatible sources. Usually that's trout or salmon. And they serve as highly specific biological messengers when they're introduced into human tissue.
Okay, let's unpack this. Because this messaging process, it represents a fundamental paradigm shift in how we treat aging.
It really does.
Because for the longest time, the absolute gold standard has been traditional dermal fillers,
Yeah.
mostly hyaluronic acid.
Yeah, the classic fillers.
But those are essentially just mechanical fixes, right? I mean, you have a wrinkle or a hollow, and a practitioner injects a gel to just like physically take up space.
That's the crux of it, yeah. Traditional fillers are, well, they're space-occupying lesions, essentially.
Oh, wow. Space-occupying lesions. That's a vivid way to put it.
I mean, they sit under the epidermis and they just push the skin outward. And, they might look good instantly, but they aren't interacting with your cellular machinery in any real structural way.
Right. Yeah.
They're just inert placeholders holding up the skin.
So to use an analogy, if you have a sagging floorboard in your house, a traditional filler is like shoving a physical brick underneath it to prop it up.
Yeah, exactly.
The floor looks flat again, but the wood itself is still weak and rotting, whereas polynucleotides act completely differently. They're biostimulators.
Right.
So instead of a brick, you are sending an architectural blueprint down to the lazy cellular construction workers, the fibroblasts, and saying, hey, get back to work, rebuild this floorboard from scratch.
I love that. That is a phenomenal way to visualize the causality here.
Yeah.
And the key to making that blueprint work is the physical structure of the polynucleotides themselves.
Because of the chains.
Yes. Because if you were to just inject raw standard DNA fragments into the skin, the body's natural enzymes would just chew them up. They degrade them almost instantly.
Oh, so they wouldn't even survive long enough to do anything.
Exactly. But because these fractions are polymerized, meaning they are linked together in these incredibly resilient long chains, they actively resist that immediate enzymatic degradation.
So they stick around long enough in the tissue to actually locate the cell receptors and, deliver those architectural instructions.
Exactly. Because they survive that initial attack, they have the time to bind to specific receptors on the surface of your fibroblasts, specifically the A2A and CD39 receptors.
Okay.
And once they lock in, they trigger this massive cascade of cellular activity. The fibroblasts literally wake up from their dormant state and start aggressively producing fresh endogenous collagen and elastin.
But wait, I have to bring up the obvious hurdle here. You're injecting fish DNA into human skin.
Yeah.
Like, what about allergies? Why doesn't the human immune system go into total overdrive and just reject it as a foreign substance?
Right. Well, what's fascinating here is that this is the most common hesitation people have. And it makes total sense on the surface. But the secret lies in the fact that DNA, at its very core, is a universal biological language.
Right, the base pairs are all the same.
Exactly. The adenine, thymine, cytosine, guanine, they're exactly the same across species. What actually triggers the immune response, what makes your body recognize a quote-unquote foreign invader and attack it, are the species-specific proteins attached to that DNA.
Oh, okay. So the manufacturing process strips all of those trigger proteins away.
It does. It is an incredibly rigorous ultra-purification process. I mean, they filter and sterilize the material to such an extreme degree until every single protein molecule is totally gone.
Wow.
Yeah, so what you are left with is just the pure, raw biological code. And because it lacks those protein markers, there's virtually zero risk of an immunogenic or allergic response. Your body doesn't see a fish, it just sees highly compatible cellular instructions.
That makes the science feel much more approachable, honestly. But just to be clear from the sources, even with all that purification, a known allergy to fish or shellfish is still considered a strict contraindication, right?
Oh, absolutely. Out of an abundance of caution, yes. If you have a fish allergy, practitioners will not perform the treatment.
Good to know. But assuming you don't have that allergy, the clinical data on how the human body responds to those instructions is just wild.
It really is.
I mean, we were looking at studies showing collagen production increasing by up to 47%. And even crazier, they measure an improvement in epidermal density, so the actual structural thickness of your skin, by 52% in just 23 days.
Yeah, a 52% increase in tissue thickness in under a month is a monumental structural change.
Yeah.
And this is where it goes beyond just collagen, because these polymerized chains also promote a biological process called angiogenesis.
Which is the creation of brand new microblood vessels, right?
Yeah, exactly. They signal the local tissue to sprout new, healthy capillary networks. So you aren't just thickening the skin, you are literally restoring the microcirculation.
Okay, wow.
You're delivering more oxygen, more nutrients, and improving the localized blood flow. And that is what fundamentally creates that genuine, healthy radiance we usually associate with youth.
The biological heavy lifting is just incredible. But let's pivot a bit. If you actually book this appointment, what happens when you sit in the clinic chair?
Right, the practical side.
Because I was reading through the consultation protocols, and practitioners have to screen really heavily for things like autoimmune diseases, vascular disease, or a history of keloid scarring.
They do, very strictly.
And I assume that's because, well, if your immune system is already hyperactive or your body naturally overproduces thick scar tissue, you absolutely do not want to introduce a serum that actively commands cellular replication.
Yeah, that is the exact clinical rationale.
You could send the whole system into a pathological overdrive, I imagine.
Precisely. You are deliberately manipulating the body's wound-healing pathways. If those pathways are already compromised or hyperreactive, a biostimulator is strictly contraindicated.
Makes sense.
And, of course, they also screen out anyone who is pregnant or breastfeeding, which is standard safety protocol across all aesthetic medicine.
Right, standard stuff. So let's say you clear the medical screening, the target area is cleansed, you are slathered in a strong topical numbing cream or spray, and you are ready to go. What does the physical injection process actually look like?
Well, it involves a targeted series of microinjections, and these are localized to the superficial layers of the skin, the dermis.
Okay.
Depending on the specific area of the face and the practitioner's training, they will use either extremely fine, short needles, or they will opt for blunt-tipped cannulas.
The cannulas seem to be really highly preferred for the delicate areas, like the under eyes.
Oh, definitely.
And that's purely for mechanical reasons, right? Because they reduce bruising.
Yeah. I mean, a needle is sharp, it slices blindly through tissue, and it can really easily pierce a micro blood vessel, which pretty much guarantees bruising.
Right. Ouch.
But a cannula is blunt. Once it is introduced under the skin through a single tiny entry point, it just slides and nudges its way through the dermal tissue. It physically pushes delicate blood vessels out of the way rather than cutting through them.
Oh, that's so much better.
It is. It significantly reduces the trauma to the tissue.
Yeah.
And the whole facial procedure is pretty quick. Usually takes about 30 to 45 minutes.
Okay, so the 30 minutes are up, the cannula comes out, the practitioner hands you the mirror. Do you walk out of the clinic looking instantly refreshed and ready for a photo shoot?
Definitely not, no.
Yeah.
And this is where expectation management is absolutely vital. You do not look refreshed.
You walk out looking a bit like human bubble wrap for a day, right?
Yeah, that is actually the most visually accurate description. Patients leave the clinic with dozens of small raised bumps at every single injection site all over their face.
Just covered in them.
Right. And in dermatology, these are referred to as blebs.
Blibs. Ah, it sounds terrible, but it's a completely normal biological necessity for this specific treatment to work.
It is. Because the serum needs to interact directly with the fibroblasts in the superficial layers of the skin, it cannot be injected too deeply. So you end up with these concentrated little pockets, these blebs, of the polynucleotide gel sitting right under the epidermis.
And they're probably red, too, right?
Yeah, you will likely also have some mild redness, swelling, or light bruising, especially around the eyes.
So the serum is just sitting there in these little superficial holding pens. How long does it take for the body to actually, resolve that?
Usually between 24 to 72 hours.
Okay, so a couple of days.
Yeah. It relies heavily on osmotic pressure. The surrounding tissue slowly absorbs those concentrated DNA fragments, pulling them in and integrating them. And as that absorption happens, the blebs just flatten out and completely disappear.
Good to know. So if this localized cellular repair works by stimulating blood flow, building collagen, and waking up dormant cells, it makes complete conceptual sense that the medical community started looking at other areas of the body.
Oh, absolutely.
Because the face is really just the testing ground. Let's look at hair restoration.
The scalp is a fantastic application for this technology.
Yeah.
Because when we talk about conditions like early stage androgenetic alopecia or just general age-related hair thinning, we are looking at hair follicles that are essentially suffocating and shrinking over time.
And injecting these long-chain DNA molecules reverses that by specifically targeting the dermal papilla cells.
Right. The dermal papilla cells sit right at the base of the hair follicle, and they act as the primary control center for hair growth. So by injecting polynucleotides directly into the scalp, we stimulate those specific cells to wake up, but even more importantly, we trigger that angiogenesis we discussed earlier.
Right, you are building new vascular networks right in the scalp.
Exactly. By increasing the local blood flow, you are delivering this massive, sustained surge of oxygen and nutrients directly to those struggling follicles. It creates a highly nurturing environment that actually reduces hair shedding and encourages thicker hair growth.
Did I imagine doing the whole scalp takes a while?
It does. Because the scalp requires extensive mapping and numerous micro-injections, these sessions can take quite a bit longer, sometimes up to 75 minutes for larger areas.
Wow. Okay, well, here's where it gets really interesting. I was looking at the sources, and the most fascinating application to me was in the realm of women's health. The protocol is called Nugen, and it's the use of polynucleotides for vulvovaginal rejuvenation.
Yes.
Because as women approach or go through menopause, the sharp drop in estrogen causes the tissues in that area to undergo severe structural changes, right? Genitourinary syndrome of menopause, or GSM.
Exactly. And it is a condition that severely impacts quality of life, yet it remains chronically under-discussed in mainstream medicine. The lack of estrogen causes the vaginal and vulvar tissues to lose their elasticity entirely. They become incredibly thin, easily inflamed, and chronically dry, which leads to daily discomfort, micro tears, and significant pain during intercourse.
Right. But if a woman is experiencing these menopause symptoms, why do this instead of hormone replacement therapy or HRT or even those laser treatments?
Well, if we connect this to the bigger picture, not every woman is a candidate for local hormones, especially those with a history of estrogen receptor-positive cancers.
Yeah, right.
Or maybe they've tried hormones and they still experience friction pain. And lasers work by causing controlled thermal damage to the vaginal wall to force a panic healing response, which is intense.
Yeah, that sounds a bit aggressive.
It is. This is where polynucleotides are genuinely revolutionary as an alternative. It is purely biological, non-hormonal, and non-thermal. The procedure itself is incredibly fast, maybe a quick 10 minutes of superficial microinjections after a strong numbing cream.
And it works using the exact same blueprint signaling mechanism as the face.
Exactly. The long-chain molecules immediately bind massive amounts of water to restore deep hydration to the dry tissue. Then, they signal the local fibroblasts to generate fresh collagen and elastin. They are literally thickening and repairing the vaginal wall from the inside out.
That's incredible.
It heals the micro tears naturally, without systemic hormones and without the thermal trauma of a laser. Patients are simply advised to avoid sexual intercourse, hot baths, or intense exercise for about 48 hours post-treatment while the tissue absorbs the serum.
It really is a brilliantly versatile tool, but whether you are treating your under eyes, your scalp, or your intimate areas, utilizing this biological repair process demands a massive psychological shift.
It really does require patience.
Because we are so conditioned by the instant gratification of traditional aesthetic medicine. You get a filler, you look different in 5 minutes. With polynucleotides, you have to wait for the cellular construction workers to actually build the new tissue.
Yes, you are investing in long-term cellular health. This is never a one-and-done fix. To get the cellular machinery running at full capacity, a standard course requires 2 to 4 separate sessions, spaced out every 2 to 4 weeks.
So you're looking at a commitment of a couple of months just for the initial loading phase. When do you actually see a difference in the mirror?
Well, you will likely notice a subtle hydrated glow within the first week or two, simply because the molecules are binding so much water. But the genuine structural changes, the newly synthesized collagen, the thicker skin, the restored elasticity, that complex biological process takes 2 to 3 months to fully mature.
And you have to maintain it too. I mean, the aging process doesn't just pause because you had a treatment. The sources show results generally last 6 to 12 months before you need a maintenance session, and they recommend doing that twice a year. So what does this all mean? When you factor in the cost, which sits roughly between 250 to 500 pounds per session, a full initial course plus maintenance is a significant financial and temporal investment. It's a huge mindset shift from instant fix to long-term skin health.
Is a serious investment. And because you are investing so heavily in creating this new tissue, the aftercare rules are absolutely strict and non-negotiable.
Let's break those down. Looking at the immediate aftercare, no touching the face, no heavy makeup, and absolutely no intense exercise or saunas for the first 24 hours.
Right.
Which makes logical sense because we've just used needles or cannulas to create thousands of micro wounds across the skin barrier. You don't want to induce heavy sweating or introduce bacteria into those puncture sites while the blebs are still settling.
Exactly. It is a critical window for infection control. But it was the long-term aftercare that really stands out.
Yes, the absolute insistence on strict use of broad-spectrum SPF. We always hear about sunscreen, but why is sunblock so critical specifically for this treatment? Like, why is it framed as a literal deal breaker?
Well, think about the biological mechanism you just paid for. You have commanded your fibroblasts to work overtime, expending massive amounts of cellular energy to build brand new, healthy collagen and elastin structures.
Right.
Ultraviolet exposure from the sun actively cleaves and degrades those exact collagen bonds.
Oh, wow.
Yeah. If you skip the SPF, you are actively undermining the exact biological process you just initiated. The UV rays are literally destroying the very proteins your body is desperately trying to build.
So you're just throwing your expensive investment away.
Exactly. Protecting that new tissue from UV degradation is the only way to ensure the structural changes actually last.
That is a stark but entirely necessary warning. So to sum it all up, when you step back and look at the whole picture, it is clear that polynucleotides represent a massive shift in aesthetic medicine. We are officially moving away from temporarily masking our age with artificial volume and moving toward literally instructing our own cells to repair and regenerate themselves.
It really is a profound evolution.
Right?
We are actively reversing localized cellular decline. And, this raises an incredibly important lingering idea to ponder.
Yeah.
Right now, we are using these DNA fragments to trigger our skin, our scalps, and our reproductive tissues to rebuild what time has worn away. But if we've successfully unlocked the biological language to command localized cellular regeneration using fish DNA, what other degenerating vital organs inside the human body might soon be instructed to rebuild themselves using these exact same biological messengers? Could the aesthetic medicine of today become the internal, life-extending medicine of tomorrow?